joining us today. I'm going to go ahead and get started. Good afternoon. My name is Angela Jaco, and welcome to the Central Illinois Chapter and the American College of Healthcare Executives and the Idaho Healthcare Executive Forum webinar, Strategic Marketing, Winning the Battle for Market and Shares. After the webinar, you will be directed to a short survey, which we hope you will take the time to fill out. Today's webinar has been awarded 1.5 hours of qualified education credit towards board certification or recertification through the American College of Healthcare Executives. If any IT problems arise, please visit support.anymeeting.com for further assistance. As we begin the presentation, please take time to mute your telephone lines until the questions and answers portion of the event. On the left-hand side of the webinar platform screen is a text box to write a question to the presenters. If you have a general question, please insert your questions into the text box. If you have a specific question for one of the presenters that you would like to ask, please insert his or her name next to your question. We are happy to announce there are many attendees who are listening from not only here in the United States, but also internationally. Just as a reminder, this webinar is being recorded. In today's competitive healthcare marketplace, a strategy for offering your products and services in a way that will be outdistance your competitors is critical. However, in concert with defining the marketing strategy, you must also have a well-defined methodology for implementation that contains a relevant, consistent message. Further, it is of little value to have a strategy and a message without the resource or expertise to implement them. In the process of creating a marketing strategy, you must consider many factors, including but not limited to the 4 P's of marketing: product, place, price, and promotion. A well-conceived marketing plan that is in concert with your strategic plan and the time and resources to put it into motion are necessary elements to increase market share and support financial success. Of those many factors, some are more important than others, because each strategy must address some unique considerations. It is not reasonable to identify every important factor at a generic level. However, many are common to all marketing strategies. Some of the more critical are described below. If the market is very attractive and your enterprise is one of the strongest in the industry, you will want to invest your best resources in support of your offering. If the market is very attractive, but your enterprise is one of the weaker ones in the industry, you must concentrate on strengthening the enterprise, using your offering as a stepping stone towards this objective. If the market is not especially attractive, but your enterprise is one of the strongest in the industry, then an effective marketing and sales effort for your offering will be good for generating near-term profits. And if the market is not especially attractive and your enterprise is one of the weaker ones in the industry, you should promote this offering only if it supports a more profitable segment. Otherwise, you should determine the most cost-effective way to divest your enterprise from this offering. Next, I'm going to talk about some of the topics that will be covered today. So we're going to target your market segments for effective tailored marketing, strengthen the relations between your strategic plan and your marketing messages. How can you capitalize on these areas of competitive difference? How do you determine the ROI of your strategic market efforts? Understand the techniques for marketing healthcare and staying ahead of the competition, and developing marketing approaches that are driven by customer needs, both current and future. We will also be talking about determining your competitive edge in the healthcare marketplace. What are your organizational strengths and who knows about them? Learn how physicians, payors, and patients make their referral and selection choices. And can your primary customers differentiate your services from those of their nearest competitors? And if they can, how do they do so? Lastly, who is involved in determining the wants and needs of your customers and potential? Now I'm going to transition into the introduction. Craig Wallstrom is our moderator for today. Craig Wallstrom is a results-oriented senior healthcare executive with more than 17 years of broad background in business, healthcare, and human services, and has extensive operational and administrative expertise. He is currently the president and CEO of the Healthcare Executive, who is leading organizational performance assessment in multiple program areas, followed up with customized C-suite healthcare training that speaks to identified needs. Craig has delivered focused programming around key elements to achieve success, based upon best practices and emerging best practices that show promise of improving healthcare organizations both nationally and internationally. He has led webinars and face-to-face seminars for 1,000 of healthcare administrators and executives through the American College of Healthcare Executives. Prior to the Healthcare Executive, Greg worked as an assistant administrator, director of social services, and as a Health Case Manager. Greg received a master's degree in business administration and healthcare management and a bachelor's degree in business administration from the University of Phoenix. He has also completed studies abroad in Shanghai University in Shanghai, China. He is a member of the American College of Healthcare Executives. Greg is also a current immediate past chairman of the Healthcare Executive Education Committee for the Central Illinois Chapter of ACHE. Now I will pass the floor over to today's course moderator, Greg Wallstrom. Good afternoon, Greg.
Hello, and good afternoon, everyone, and thank you, Angela, for the wonderful introduction. I am honored the Healthcare Executive Forum and the Central Illinois Chapter of ACHE invited me to facilitate today's course. I would like to introduce our champions in the healthcare industry. Our first presenter, Ramiro Roman, MS, Chief Marketing Officer, Workforce Solutions at API Healthcare, AGE Healthcare Company. Ramiro and his team are responsible for developing and executing the global marketing strategy for API Healthcare Workforce Management Solutions, including market opportunity assessment, competitive intelligence, segmentation, price, ad and promotion, commercial launches, messaging, and marketing campaigns. Ramiro and his team identify global priorities, direct product and regional marketing strategies, and provide critical inputs into the API Healthcare business strategy. Ramiro joined GE Healthcare IT from the GE Healthcare USEAN marketing team, where he was General Manager, Marketing Operations. In this role, Ramiro led the demand generation and install-based centers of excellence and was responsible for marketing planning, measurement, reporting, budgeting, automation technology, platforms, and process improvement for GE Healthcare's multi-billion-dollar equipment and service portfolio. Ramiro joined GE Healthcare in 2006 and served in several leadership roles, including Chief Marketing Officer of Service and Asset Management Solutions, USEAN. He began his professional career at Johnson & Johnson, serving an upwardly global 14-year career in various commercial leadership roles in marketing, sales, and business development disciplines. Ramiro holds a Master's of Science in Organizational Development from Loyola University Chicago Graduate School of Business and a Bachelor's of Science in Business Administration from Indiana University Kelley School of Business. He currently sits on the editorial advisory board and is writing contributor for the PM360 magazine. In addition, he serves as a GE Healthcare Business Champion for the award-winning Hispanic Forum. Ramiro is married to Lucia and has 5 kids: Teresa, Ramiro, Jacqueline, Christos, and David. Our next presenter, Don Stezano, MHA, APR, Corporate Vice President, Marketing and Communications, Scripps Health. Don Stezano is Corporate Vice President and Chief Marketing Officer for Scripps Health, a $2.6 billion nonprofit integrated healthcare delivery system based in San Diego. Scripps operates 5 acute care hospital campuses, 26 outpatient clinics, home health, hospice, and specialty centers, including Scripps Proton Therapy Center and the Krebs Cardiovascular Institute, among the top 20 and cardiovascular programs in the country. Throughout its 92-year history, Scripps has been a leader in medical research. The National Institute of Health supported Scripps Translational Science Institute as a leader in translational genomics and digital medical technology. Scripps is expanding its retail brand, Scripps Health Express, and recently announced plans to launch its own health plan. Don has 20 years of experience in healthcare communications and marketing after spending 10 years as a professional journalist. He holds a master's degree in healthcare administration from Ohio University and a bachelor's of journalism from Bowling Green State University. He is accredited in public relations, APR. At Scripps, he is responsible for all the strategic marketing and communication functions, including direct-to-direct consumer marketing, consumer call center, web and digital marketing strategies, media and community relations, and employee and physician communication. And our final presenter, Randall Carter, Senior Vice President, Plaintree Incorporated. Randall L. Carter, Plaintree's Senior Vice President, has spoken and provided consultation on the topics of patient-centered care and experience, healing environment, service and leadership, quality and safety, and employee experience to healthcare organizations, physician groups, and audiences in building and designing retail, software, education, broadcasting, and government. For 25 years, Mr. Carter has been instrumental in the application of Plaintree's patient and family-centered concepts in the United States and over the past decade in the cultures of the Netherlands, Iceland, Canada, and most recently Japan, Brazil, and Saudi Arabia. Since our founding by a patient in 1978, Plaintree has defined what it means to be patient and family-centered. Plaintree's philosophy is based on a simple premises. Care should be organized first and foremost around the needs of the patient. To understand those needs, Plaintree turned to the source thousands of focus groups from bedside to boardroom with patients, long-term care residents, families, communities, and professional caregivers across the globe have borne out their needs and desires for a more personalized, humanized, and demystified healthcare experience. Bringing these concepts to life requires a short, not merely in operations, but fundamentally in culture. Plaintree guides providers through a structured process that enables caregivers to transform the healthcare experience they provide. Today, Plaintree provides consultation, training, resource support, and collaborative community to over 700 organizations in 19 countries around the world. Now I'd like to take the opportunity to pass the floor over to our first presenter, Ramiro Roman. Good afternoon, Mr. Roman.
Hello, Greg. Thank you. Thank you for that warm introduction. It's an honor to be with you and all your constituents today, inclusive of Don and Randall on this panel. I've been asked to address a couple of questions around target market segments, competitive positioning, etc. And I'd say that this is an opportunistic time in healthcare to be thinking about marketing, strategic marketing in particular. As you look what's happening with provider consolidation, intense competitions bring the best of us, including our market share appetite. Also, as you look at what's happening with patient empowerment and patient really having multiple choices, our ability to compete for those lives is ever present. And then finally, technology really is here today, and it's going to be a game changer, both in the positive, if you can learn how to leverage it, but it can also hurt you. So we'll talk about all of these three segments and relates to how that relates to segmentation, positioning, etc. I'll also say that I'll be using a lot of examples and some tools that I've used in the past. They're going to be included in your slides. Please feel free to use them. I see this as the beginning of a dialogue. There's certainly a lot of work to be done for you to ascertain what is that strategic position you want to own in your marketplace. I use a lot of consumer examples because they're easier for us to relate to, and I hope you find this educational. I'll start off with a little bit of humor, but it really sets the tone for what we think about marketing, things we should be digesting. On this slide you see here, someone says, we should target women ages 18 to 49. And then the other person says, yeah, right, but where does that leave men, boomers, and everyone else in the known universe? And this humor really strikes at the heart of what it is to have a segmentation strategy. The reality, and this is one of the cardinal sins, that we can't target every single patient in our communities, in our geographies, that we can't target them effectively. We really need to bucketize or segment, if you will, consumers as subsets who have very shared needs, and then design and implement strategies to target them. Now, that's easier said than done, right? So on the left-hand side is a very simple but powerful tool that you can use in your organization. For example, you can list what are the top 10, to start with, trends happening in your geography where you compete. Once you list those, take a look and plot them around this axis. What is the magnitude of effect and that can have on your business? And what is the likelihood of that occurring over the next 3 years? And very simply, go through the 10 and give them a red, yellow, green. Red for it could be a negative consequence. Yellow needs to be mindful of, and green is something you can leverage. Plot them here and really understand where your leverage can be by focusing on the right upper hand corner. Those are things that can really help you position your business. Those are trends that can really give you air wind, if you will, to help you compete in the marketplace. And by focusing on these trends, it's really the beginning of a strategic plan. On the right-hand side, a bit more micro, right? Once you understand what those trends are, once you understand what some of the environment looks like, what does your particular competitive framework look like? This is Michael Porter's 5 Forces. It's a very well-known strategic tool. And really ask you to look at your suppliers, substitute buyers, and your entrants to determine the profitability of competing in that space. right? So just because we can compete in many places doesn't mean we have to. We have to be mindful of the profitability that comes along with that. At least our ability to compete in spaces where we want to and have an advantage. Now, as it relates to competitors, right, it's often the easiest one for us to see. Here's a simple diagram that I've used many years to really try to understand who are our competitors today, meaning the actual competitors, direct, indirect, and potential complementers, which can be competitors but don't have to be, as well as the potential. And very quickly, as you look at this diagram here, your actual and direct, these are easy to see, right? You can see them around the corner. You know those are your well-known competitors. What's less known is more your actual and direct. But these are products, services, institutions that are beginning to sip some of your demand and take it away from you. You need to be mindful of that. Your actual complementers could be potential opportunities for partnerships that you may have. As it relates to potential, it takes a little bit broader thinking, a little more future thinking. But there are new entrants in your direct that are going to come into every one of our space. For example, telemedicine, which can have a disruptive in a playing field that has disruptive impact. There could also be potential indirect that can shift your business model. And then lastly, potential complementers that you need to be mindful of. So when you think about your trends, you think about your industry, and you think about competitors, you want to nail down to a specific target audience and not be, as the cartoon earlier on, humored. I love this book. It's an old book now. It's an article developed in the 60s, fine-tuned into a book in the 80s, and it talks about positioning. And the reason why I always come back to this is it's very simple. And what it says for us, particularly those of us in healthcare who are more science-based and want to justify, and rightly so, right, what we offer, is this book really challenged the view of inside out, meaning it's not about what we think we are as a hospital, as an organization, as a system, as a corporation. It's more important to think about what our consumers think about us. And positioning is relevant only in the mind of our target audience. And by the way, it's perceived importance. Now, that does not mean we need to be unethical in our marketing practices. Of course, we shouldn't be. But it does mean that we do have to shape that perception as we come to it. On the right-hand side is a bit of a simple diagram. If you were to produce a product, you have to map yourself around the buying parameters. And whether you're let's say expensive and fast, that requires a very different positioning. The question is ultimately, it's not what you think or what your marketer thinks, people like myself, it's what your perceived advantages with that target audience. So there's ways to get to your target segment, to identify them, and once you identify them, you really got to make a play for what is it that they perceive about you. Here's an example that we've used in a large business that we ran on marketing to understand our segmentation. And we used a bit of a different approach here. We used what's called as behavioral-based segmentation. That's taking a look at the data for the last several years of what our consumers purchased and understand what the common needs are and try to forecast the future needs by doing some voice of the customer. I'll quickly explain how we did this. We realized that the two variables where consumers made decisions to purchase our solutions and services versus competitors were really around risk tolerance and business model. Those were the final axes. Of course, there were others we need to be at par, but this was the differentials for us. We then decided to map out our services and where we competed. The core represents here where we expanded 80% of our revenues and profit. So this we call our core business, and we wanted to expand that. But what we quickly saw is that there were, on the high end, the extent, potential offerings that we could upsell ourselves into and reach more of our target audience that we currently weren't. Equally, on the adjacent market, bottom right-hand corner, there was a market segment that today we were not addressing. This was a few years ago. And finally, on the upper right-hand corner, there was a market that we were never going to go after. And I think what this does is, in a very simple way for you, clearly there's a lot of data and science behind this, but it maps out very clearly where you're going to compete and where you're not, where you have a core holding and where you need to expand your market. Now, once you have an identified target market, once you understand the segmentation, once you understand where you're going to compete or not, the question then becomes, how do you take that and really relay it into a marketing message? I love this concentric circles here. It very quickly lays out how we should think about this. So I mentioned earlier positioning, right? Brought in target perceptions, your target market perceptions. We all have competitors, and again, we're talking about direct, indirect, and potential complementers. And then we have our own value proposition of things we want to stand for that target audience. So as I was saying, right, so these concentric circles really lay out, once you understand your target audience and you understand your competitors, and you crafted a value prop, where is it that you want to communicate? Oftentimes, a cardinal sin that I see is we want to be a me too. We see our competitors around the corner announce a new campaign. It could be a new billboard, a new web advertisement. It could be a new commercial. And we quickly say, why don't we say the same thing? Well, the truth is that when you map this out and you look at it, if you say the same thing, you're going to be commoditized just like they are, and you're not really leveraging where you need to be. The sweet spot in these concentric circles really is number one. Where do you have the advantage where you are relatable to your target audience? That is really where you should spend your marketing dollars to maximize them strategically. I love this example on the left-hand side. It lays out how Walmart and Sears and other mom-and-pop stores have competed over the years. On the left-hand side, you see decision-making criteria, important variables to their target audience. And then you follow the lines, you'll see how each of the independent competitors have competed in the space. Again, I love seeing consumer examples because they clearly illustrate it, and we can see that today. Walmart chose to be the low price leader, period. And they staked their entire positioning there. And they walked away for some other things, for example, ambiance, right? Where a product like Sears or a competitor like Sears decided to stake its claim in rural locations, right? Convenience. Now, we've known over time that that was a wrong bet, right? As supply chain has gotten better, as the expansion of Walmart continues, as the low prices allow it to grow, they have dominated that space too. This is a similar kind of conversation you need to be identifying between you and your competitors. What are those beachheads where you want to compete, and where do you really want to make a difference? Here's another brief example. Again, you can read it in your slides. Because it's not, what I love about this, on the left-hand side, it's Vanguard. It's a low-price provider, low-cost provider of mutual funds. And their claim to fame is really low cost. What this says, though, it's beyond just the low cost, right? You need to engineer a system of activities that has a multiplier effect so that your positioning, your differentiator, is accented in everything you do. When you outline your strategy and you map out your entire value chain to accentuate that positioning, you will be successful. And I love it on the right-hand side how they just simply, in a very succinct way, communicate the advertising to maximize their dollars. So how do you continue to capitalize on the competitive difference? I love Michael Porter. I keep referring back to him because he really is a grandfather, a strategist here. He really says, look, it's about being different. It's about the unique mix of value, the value chain that we discussed. It's about doing different activities in your competition that really play to your unique advantages. But importantly, it's about what not to do. And I can't stress that enough. We as strategists, sometimes we become overambitious, or data can blind us. Opportunity, is in every corner. We got to be clear about what we don't do to maximize our dollars. Those of you who have been around this world for more than 50 years, remember there used to be a day when big cars were in play, and being big was a big thing. Well, around this time came Volkswagen with the Bug, and I love how they capitalize on their smallness. This is one of the best advertising campaigns of all time. It shows very simple, very small car, and it says think small. Beautiful illustration. I wanted to show this commercial here too, this advertisement, because look, branding, messaging needs to be relative. On the left-hand side, you see in this ad, you see some Marlboro ads that were done when they were targeting women and actually utilizing babies. Today, we know that this is a no-no, but that's how they were. Then they morphed, obviously, into the cowboy. I also want to say, how do you communicate your message and differentiate really does matter over time. So in healthcare, we all know this example of Viagra, first to market. When it first came to market, 70% of the purchasing decisions were made on efficacy and safety. Well, lo and along comes Cialis, who had a par equal to others, but their advantage was long duration. And they spent their entire marketing campaign on long duration. When Viagra was the dominant player, long duration was only 10% of the decision-making process. Over time, marketing dollars, consistency of message, data proved that longitude of duration mattered, and dialysis became the market leader. You can do that too with your enterprises. I love this example for Hyundai. Hyundai, this was during the crisis of the 2009. They had their flagship product. They were introducing the Genesis, the new Genesis. They didn't go with it saying I'm a Honda too, although they could have, especially with economic pressures. If you look at the left-hand side, they're framing their competition as premium and going after BMW, Lexus, etc. Also, something uniquely they did, Hyundai during this time, if you may recall, they offered a unique pricing structure that said, if you lose your job, we'll pay your car payments. You don't lose your car. Only about 2% of consumers ever took them up on that. However, during that time, they nearly doubled their sales while their competition declined 37%. The power of framing. Here's another great example, because I think healthcare needs more of this, by the way. Where you compete and where you perceive to compete matters. Brita, we all know Brita, the filter of water, used to be along with all the house appliances. Well, they moved some of the store shelves to be in the beverage sections right with the water. And they increased their market share fivefold just by doing the simple play, right? Same product, but it just depends on how you frame it. Again, it's about the perceptions. Lastly, I want to talk to you a little bit about ROI. And this is really where technology has given us as marketers and as organizations the biggest advantages over the last 5 years. Technology that's been used in the consumer world has come to healthcare, has come into B2B space. The first thing I want to say about ROI is on the left-hand side, as it shows, and we know this, 60% of decisions get made while people, before they even step into line or talk to one of our customer reps or salespeople. They're online, they're talking to social groups, they're collaborating, they're asking their neighbors. It's a great marketing challenge that we now have tools to infiltrate and educate and influence the right decision-making process. The question is, are we always being consistent with our positioning when we do that? And I'd say not all the time. It's tough to do, but we need to do that. We continue to invest in marketing automation, as the right hand shows, this idea of technology helping marketing and automating it so that we can really talk to hundreds of thousands of people at the same time. We can monitor with their feelings. We can understand their decision-making process. Has made a revolutionary breakthrough in marketing. When we think about it, let's say a patient or a consumer that's going to absorb our services, we need to think of it in terms of a long decision-making process, whether that process is 3 weeks or it is 6 months, right? And the point of this slide is, as you're thinking about your ROI, I kind of use the analogy of football, right? In football, of course you want to get to the touchdown, but you're not going to start measuring at the 99-yard line. You want to make sure that you have a clear view from the 0 through the 10 to the 20 to the 30, etc. yard lines. And you want to feed the right education, the right information to the right consumer at the right time. So here's an example that we've used in the past. Honestly, your consumers expect this, right? Consumers are savvy now. Patients look online. They expect us to give them the right information at the right time to make those decisions. And where before we might have looked at things like automation and the traditional view is more like someone's getting engaged with me, someone's calling my call center, someone's asking for a referral. We now need to expand that view and think about, even before they touch me, even before I know who they are, how am I influencing that perception of that target audience? And on the latter hand side, once they come in, how do I make sure I'm bringing them into the door and capitalizing on them? I'm going to leave this slide with you. It's a very good model used by SiriusDecision that really breaks down how you take awareness, interest, all the way through purchase and repurchase. And for those of us in healthcare, there are benchmarks out there which we can participate in and learn how we're doing versus our competition against best practices, and then what are things that we can do to get better. So I thank you for your time, and I welcome any questions. Greg?
Thank you, Ramiro. Thanks for sharing that with us. I just wanted to interject a couple of quick questions before we move on to Don's section of the presentation. Could you tell us who is involved in determining the wants and the needs of your customers and potential customers?
Absolutely, Greg. Good question. I think who is involved is a multiple answer, right? So certainly your marketing team should be involved. You should have some type of market research arm, whether it's in-house or third party, that keeps you honest and fair balance of what's going on in the marketplace. I would also include folks that are in charge of the strategic planning. I would include folks that are in charge of customer service and patient care to help you determine and get a holistic view of what's happening in the market. Additionally, I would look to third parties like the ACHE to help you understand what's going on in the broader context and other industry leaders to understand that. I would like to last say on this question that it's not a once and done, right? Customer trends, competitive threats, perceptions shift. Our ability to monitor that and to respond to that, especially in today's technology savvy consumer and patient, is a must.
And then one final question that I wanted to ask is, what are the ways to effectively respond to local market demands while staying aware of the needs and capabilities of the entire organization?
Yeah, good question. I like the way you phrased it because it really is the first part, right? We strive to be a market-driven organization. We strive to think about the patients and the consumers we serve first and foremost, and we think about capability second. And so I would answer that question by saying keep focused on what's going on outside. What are those trends? Utilize some of the tools we talked about. There's many more tools. Make this part of a strategic planning session that's not a one and done, and you put your business plan away for the year or 3 years, but one that you revisit quarterly and make sure that you're still on target with some early indicators to tell you and verify through data whether you are or not. And then secondarily, depending on where you want to compete, building those capabilities to serve that marketplace.
Great. Thanks for sharing. I appreciate that, Ramiro. Now I'd like to pass the floor over to Don Spezzano. Good afternoon, Don.
Good afternoon, everyone. Thank you for having me, Greg. Yeah, I'd like to share with you a couple of points on how we are marketing healthcare from the provider perspective and some of the things that we're doing to sort of bring to life what Ramiro talked about. And I really appreciate some of what Ramiro was saying about avoiding the Me Too syndrome, because we do see that in healthcare quite a bit. Actually, our ad agency, when we first engaged with them, talked about something called the Sea of Sameness, and that they pulled up a slide that showed healthcare advertising from around the country and how it all sort of looked the same, and it does. And that's because the work we do is so similar, but I do think we have to worry about that commoditization that Ramiro talked about. So one of the things that we've been working on here at Scripps is really shifting our marketing program away from just the promotions aspect of those 4 Ps and getting more involved in the other 3 Ps in that 4P marketing foundation, and also moving towards 21st century marketing practices that we see in every other aspect of our lives and all the other industries, where I think healthcare, particularly on the provider side, is a bit of a laggard. And so we're running fast toward the digital and data-driven marketing techniques and strategies that Ramiro teed up very well. On the next slide, you'll see a list of techniques that we're employing at Scripps. We are, as I mentioned, we're moving beyond traditional brand advertising, and we're embracing the direct response marketing. We have brought on a sophisticated consumer relationship management system, a CRM system, that may not seem radical in other industries, but I think in the provider community in healthcare, really having access. We have a lot of information in health systems. It's not what I've found in my role is that it wasn't always easy to access, and it was difficult to gain insights from the data that was being provided to me. So evolving the marketing program here at Scripps to be a data owner and a repository of data, because we are capturing data here that no one else in the organization provides, which allows us to become that consultant on price, product, placement, where perhaps we weren't part of those conversations as much in the past. We employ a digital-first approach. In other words, I'm not spending money to market a service line or a program unless we have a strong digital platform and there's a digital strategy as the backbone of it. What is the web content? Do we have data from our website to show that consumers are looking for that product, and how are they searching for it? So that you can develop a keyword strategy around digital marketing. Before we do offline marketing, we want to make sure that we've got a digital marketing foundation built. embrace the big idea and drive insights to develop your marketing strategies. So that gets back to something Ramiro was talking about that differentiation. Know your place in the market. I get asked often when I'm talking to groups inside our organization about our marketing strategy, and often it starts with a, why aren't we doing X? Because they see something that one of our competitors is doing. We operate in the San Diego market. The San Diego market has 4 very dominant competitors, each carving up a very defined piece of the marketplace, and so it's hand-to-hand warfare every day in terms of market share, battle for market share here, and everyone's taking a different approach and they're playing on their strengths. So it would be very easy for me to say, well, if competitor A is running television or putting up billboards, why we should be doing the same. We have to keep up, but that may not be the appropriate approach for our strategies. Providing that education inside the organization, because I do get those questions often about why not there, and my answer often is, first of all, you're not seeing our marketing because you're probably not part of that target market segment that we're going after for that service. So, and then number 2, we're marching down our own path based on our strategies. Our competitor strategies are different, and keeping that in mind when there's the pressure to kind of keep up, and that comes from both up above and from across the organization. I'm sure that many of my colleagues on the phone have experienced that. Having marketing analysts on staff. I don't know about Ramiro's experience, but I know with inside healthcare providers, having marketing analysts as part of the marketing team was definitely a new concept for us, and I've talked to a lot of my colleagues across the country who are either beginning to bring that functionality on their team, that skill set, or have yet to do so. So I think if you're going to embrace data and a digital first approach, you've got to have folks on your team who understand how to glean insights from data. Every brand has a unique story, and you need to be out there talking about it. And today, in 2016, there are so many opportunities to do that through digital platforms. We are on a journey to do that here at Scripps, but making sure that you're very clear about what your brand story is, where you fit in the marketplace, and who your audiences are, and then deriving a strategy to address that. Whether it's launching a blog, using your social channels, leveraging your website, and also your paid advertising and your earned media, that whole portfolio to tell that unique brand story. Shaping the product. We are actively having conversations now in our organization and talking about patients as customers in a way that I had never seen before in my 20 years in healthcare. I remember talking to colleagues in the past outside of the marketing department here where the word customer was sort of a bad word. And now I think everyone understands that our patients do have choice and they behave like customers, and bringing some of that retail thinking into healthcare, I think, has been very healthy for us because it's allowed us to think about what the customer wants and how to best meet their needs. And I think as marketers, we have a unique opportunity in our organizations to do that, particularly when we're bringing forward data that we're gleaning from our CRM systems, our web platforms, our social channels. We hear the voice of the customer every day based on what they're clicking, what they're engaging with, what the online forms they're filling out, and so forth. And then last on this slide, talent and budgets need to shift. And I think there was a slide in Ramiro's presentation about how marketing dollars are shifting to digital. We're doing the same thing. And the big spend on broad market creative is being replaced by micro-targeting in the digital space and really looking at the best way to deliver ROI for that marketing dollar. I'm going to talk about developing marketing approaches that are driven by consumer need. You need to study your market. You need to understand what's going on out there in the marketplace. On a brand level, we do a quarterly brand survey. We're looking at preference and awareness, both aided and unaided, against our competitors. And then we're looking at how we're performing against the drivers of choice, and we've done surveys to determine what are those drivers and how we're performing relative against those. We do survey and use patient panels. We have an online patient panel that we engage to ask a whole host of questions, from very specific marketing questions. We might test some advertising with them, all the way up to product and price-related questions and where we would place certain services. Should we put a clinic here? If we did, what sort of services would you like? What are the hours that you'd like to access those services? So we've got a whole panel of patients from across our market who have raised their hand and said they are willing to share information with us, and we leverage that quite frequently. I mentioned this earlier, speaking for the customer when operating decisions are being made. I'm finding that is coming up more and more because the word customer is now being embraced across the organization. And I was just in a conversation yesterday with a group of colleagues where we were looking at trends in the review sites that and we monitor the comments that are being made about scripts on review sites and what's trending there. So that is bringing the voice of the customer in a very tangible way to operational decisions. And we're looking at, okay, well, for example, if the number one issue among folks who are talking about us on review sites is related to billing, the number one negative issue, then we need to look at our billing practices. If it's scheduling, maybe we should be looking at scheduling. I see a question here from someone asking about brand journalism. What do I mean by that? Brand journalism is a term that is another way of saying content marketing, and I'll define that as well. Those are terms that are used for media that we are generating ourselves. So where earned media might be a PR placement in a newspaper, magazine, television, or online blog, paid media is advertising. Owned media would be creating content for your brand that is placed out there on channels that perhaps you control. So whether it's on your Facebook page, through your Twitter account, through a blog that your company has launched, and it's providing value to your customers. It's telling your unique brand story, not in an overt way, not in an effort to directly sell, but to add value to your customer in a way that promotes your brand and tells your brand story. I hope that addresses the question. I'm happy to elaborate further if necessary. Lastly, on this slide, your website and digital marketing provide a wealth of data about your customers. You need to know what's working and do more of that. So we are in a constant iterative state of marketing, analytics, and evolution, where we are looking at what is happening on our website and our landing pages and with our digital paid advertising. What are people clicking on? What are they responding to? Where's the traffic going? And we provide more of that. If it's not being engaged, if it's not engaging content, we turn it off, or we have to do a total reboot. But I think you can gain a lot of insights without a lot of investment in market research by looking at the data you have at your fingertips through the clicks that you're getting on all of your digital platforms. How do we determine our competitive edge in the healthcare marketplace? We know, based on the data that we're getting from some of our market research, and our customers are not just patients, they're also employers who pay for the healthcare benefits for their employees, and so that's an important audience for us as well. They're looking for value. They want high quality care, they want convenience, they want access, and they're willing to pay for it if they believe they're getting value. So you have to define what that value is. Value is the best quality for the best price. So looking at a way, how can we best provide employers or patients directly with a sense that they're getting value for their healthcare dollar. Patients have more skin in the game now in terms of out-of-pocket spending. They're willing to shop around for services when they have co-pays and deductibles, and you need to make sure that the value equation is there. I believe that most patients assume quality, and what we as healthcare providers believe is a determinant of quality is not always what the patient or the consumer sees or understands. And there's a lot of public data out there on quality metrics that many of our organizations are chasing that I'm not sure consumers fully understand and appreciate. They're rating quality on a whole host of things that anyone who's clinically trained would not consider part of the quality equation, and those are more around the patient experience and the level of service that they're getting. They want easy access. They want everyone to be attuned to their needs and listen to them. They want convenience, and they want to understand what the cost is going to be without a big surprise at the end of the experience. But in terms of clinical quality, that's often just assumed. And unless you've shaken their trust in some way, in terms of patient safety, they're going to assume that quality is the same across the board. Everyone's busy. I think those of us who work in healthcare are no different than anyone else, but I don't know if we're always thinking about the fact that our patients, our customers, and those customers have busy lives, and they want easy access, and if they can't get access to you for what they need, they'll move on. And Ramiro mentioned this earlier too, with the direct competitors versus indirect competitors and market disruptors. When you look at some of the things that are going on in the healthcare provider space more broadly, and looking at retail pharmacies getting into the business of providing flu shots and health screenings, that's cutting into the traditional healthcare provider set of offerings. And if a patient is going to a national drugstore chain, pharmacy chain, to get their flu shot, that means they're not coming into our physician offices for that flu shot, and we're losing that business. So why would they do that? They're going to do that because it's more convenient for them. It fits into their lifestyle. As providers, we need to think more about what's convenient for our patients, and that means thinking like a customer. Cost is always a factor. Unless you're a premium brand and you can justify the fact that you're a premium brand, you need to provide premium service, access, and quality. And if you can't differentiate your product, then you need to work internally to improve the product first and then market. And these are conversations we have inside our organization when a particular service line or program is seeking marketing support to grow, and we look at access. If they have long wait times and they're difficult to get in, we tell them they need to work on that before we can spend marketing dollars. If they have outcome challenges, certainly that's not something where they're not ready to market. If they have service issues beyond just scheduling, those are things that we need to working on and looking at cost and looking at the return. Is the marketing expenditure worth what the program would yield on the back end? So those are all things that need to be worked on. What are we doing? What are our strengths, and who knows about them? Well, at Scripps, we have a legacy of quality care. I'm very fortunate that over the last 90 years, we've built up a reputation in our market and nationally as an institution that provides high quality care. Even though I said earlier that patients don't know how to evaluate quality typically, they do have perceptions of brands in healthcare, and I believe, and we see this in our brand tracking surveys, that we are perceived as a quality leader among our competitors. And so that's a differentiator for us. Our physicians are seen as an outstanding asset for us when we leverage that. We leverage our physicians, we leverage our technology when we have new offerings in terms of programs and services. Our Proton Therapy Center is an example of that. We're one of only 16 in the country, and we're the first in this market. And if you can demonstrate quality, and we use demonstrations that consumers can relate to, we use such as our U.S. News rankings, and that has come under criticism from some in healthcare about not being, a complete, accurate look at quality. But it is a mark that consumers understand, and so we do leverage that, and we're very proud of our performance on those lists, and that's how we used to work. That's what we use to differentiate ourselves from our competitors. Increasingly, we are looking at access and service as differentiators, where we can demonstrate that we have not only the quality that you expect from our brand, but also we make it easy for you to get to us. We're listening to you, the customer, in terms of your lifestyle and trying to fit into your life in the places that are convenient for you. That's how we're trying to position ourselves going forward. We know we have to have a superior customer experience. particularly if price is not competitive. And that has been one of our challenges in our market is we're not the lowest cost provider. So how do we, as I mentioned earlier, demonstrate value? I believe we can demonstrate value through the level of service and the access. And then we're also expanding access points for customers to make it easier for consumers to choose us. We opened a retail clinic in December with plans to expand that brand, telehealth, and I operate our call center that handles physician referrals and is really our customer contact, our 1-800-SCRIPTS line. At the beginning of October, we went to 7-day-a-week operations there. Previously, we weren't open on Saturday and Sundays, and we expanded our hours into 9 p.m., and we're seeing consumers really engaging with us during those new expanded hours. So I believe we're adding value in that way. That I'll turn it over back to Greg and any questions that anyone would have.
Thank you, Don. Wonderful presentation. As you mentioned the techniques and staying ahead of the competition, one of the questions that I do have is, in what ways are you using staff, board physicians, and patients as key members of your marketing team?
I think it's a great question. And again, as I go around the organization, I like to remind folks that while I have a responsibility for marketing the organization, everyone who wears a Scripps badge and everyone who is employed by Scripps is a brand ambassador. And so one way that I engage the folks who come to us for support for their programs and services is to remind them that they're part of the marketing team, just in the way that they provide service to their patients every day. And to one another, because if we're working well together as an organization, ultimately the customer is going to benefit from that. But I think, to answer your question a little further, I think we are engaging patients by listening to them, by having those online panels, asking questions about what their expectations and needs are, and then addressing that through either programmatically with our clinical and operational teams to build a better product, or to provide us with more insights into how to market to them. I think our staff and our physicians are engaged when we talk to them about whether or not they're ready to go to market. And when I get a request from a physician or a program leader in a clinical department where they want some support from marketing to grow volume, we dissect what's going on in their department and really ask those questions about market readiness. Can they accommodate increased patient load? What's the competitive landscape for that service in terms of price, location? What are the traditional patient pathways into their service? And that's another thing in healthcare. Sometimes direct-to-consumer marketing isn't appropriate. Sometimes the service is so highly specialized that it is very much a physician-to-physician and on almost 100% physician referral program. If that's the case, then it's a completely different conversation, and we would work with them to improve relationships with prospective referring physicians, versus a more overt public marketing campaign. So in those ways, that's how we engage our colleagues in our marketing.
And as you talked about organizational strengths, can you tell us how physicians, payers, and patients make their referral and selection choices?
I think it's a little different for each one. And I think I'll start with payers, because that's the first gate within the whole gatekeeping system of how a customer actually ends up in a provider office. I work with our payer relations team here at Scripps very closely, because when we have a new relationship with a new payer, or we've developed and we are doing that. We are developing unique payer products in our market with commercial payers, creating narrow networks, for example, so that if patients are looking for Scripps uniquely, maybe there's a Scripps branded plan out there in partnership with a commercial payer. And so, payers play a huge role in determining where patients end up on the provider side, because we have to be in network for a patient to choose us, and we have to have a contract with that payer to be in network. Physicians are important too. We have about 2,600 physicians on our medical staff across the organization. About 800 of those are practices that are in a foundation model, which in California is the equivalent to sort of an employed model. That means that the remainder, the other 1,200 doctors are, or what is that, 1,800 doctors are independent community-based physicians. They're an independent practice. And they're closely aligned with scripts, many of them, most of them, but we need to maintain those relationships and those loyalties. So another aspect of my department's work is to work in collaboration with those affiliated physicians out in the community to make sure that we are that our programs are attracting their referrals and making sure that they are sending their patients to us when appropriate. I do think that in 2016, price and cost are bigger than they've ever been before. I think patients are much more price sensitive because they are health plans have now lowered monthly premiums so that to shift more of the cost to the patient. So the patient is looking at what their copays are, what their deductibles are, how much out-of-pocket costs they have. And so we have to be sensitive as providers to that new dynamic in the marketplace.
Thanks for sharing those thoughts with us, Don. Now I'd like to pass the floor over to our final presenter for this afternoon. Good afternoon, Randall.
Good afternoon, Greg. Thanks for the opportunity to be here, and certainly appreciate the great information and insights that Romero and Don have shared with the group thus far, and appreciate everybody taking time out of their busy day to join with us in this session. So just to build off some of the information that has been shared up to this point in time, I'll take a slightly different approach than the two co-presenters here. Really looking at the questions that we have before us, specifically from and through the patient's lens as an organization that was founded by a patient back in 1978. Plaintree really has been engaged with patients for almost 4 decades now, really looking at what makes a difference to them from their perspective, what are their hopes, their aspirations as they engage the healthcare system. And that's certainly changed, but there's a lot of both common ground and some things that haven't changed over the years. And when we look at how physicians and payers and patients make their referral choices and selections, I think John talked about that from the perspective of you have to be in touch, and it's clearly a changing landscape. And I think what we've seen over the last few years is most folks are kind of on the left-hand side of this slide. We've been in acquisition partnering mode, developing not only our networks, but also our IT infrastructure, and really trying to get our hands around that with the aim downstream of creating multiple entry points and options that consumers can both appreciate and take advantage of. And while many hope to move beyond that traditional network of value into that narrow network or integrated experience across points of contact, the reality is that is still very much a distant opportunity for most consumers that we talk to, and we facilitate thousands of patient focus groups and consumer focus groups here nationally and internationally. And it doesn't mean that promise is not out there. It just means that folks are not experiencing that most often in their experiences in healthcare. So that promise is out there. We're marketing that message of patient-centered care, but I think, and patient experience, but I think by and large, there's still great upside potential for us. And I think the referrals downstream, individuals and organizations and key stakeholders, employers and payers are going to be looking for those organizations that can tie that together in a coherent, recognizable, and comprehensive way in the future. Moving from we're assembling to being able to deliver that. I think for organizations that are able to deliver that, you're going to get not only an initial bump in terms of creating some distance between ourselves and competitors in the marketplace, we really are going to create an opportunity for a different kind of engagement and loyalty with patients and consumers, where part of the hallmark of that process is going to be a greater level of intimacy with and for the patients and the communities we serve. And I think, as illustrated in the slide, many times we're trying to explore and get people to understand who we are in the healthcare sector, and the patients are holding up the same sign and saying, get to know me first and then develop your systems around that. In many conversations that I'm in with healthcare organizations across the country, really what we're looking for is that underlying operating system like you get with your iPhone or Apple, where that becomes so intuitive that people love the operating system, know the expectations that are created within a particular system of delivery of care. And because of that, that level of familiarity drives loyalty and a desire to stay within a network, or potentially be pulled to another network if someone else can demonstrate that at a higher level. While most organizations are still in the assembly phase, it doesn't mean that we can't be looking for that common ground that creates greater opportunity for us to develop and deliver these kinds of services that are connected clearly and consistently and coherently across the system. I think it was Greg or Don who mentioned the sea of seamlessness. As somebody who travels the country to a much greater degree than many, I think, in healthcare, I get to see hundreds of organizations on an annual basis. You can really pick up somebody's billboard on the West Coast and drop it somewhere in the Midwest, and it would fit pretty nicely if you just changed the logos. There is that sea of sameness out there. One of the questions that we have in terms of developing value for the consumer, as Romero mentioned, success is largely defined by and through the eyes of the consumer. Really taking the opportunity to connect with what people can get their hands around and what they understand specifically about healthcare, understanding that that's being developed as we speak, and a greater understanding of quality and outcomes. All of those things are in advance, but some of the things we still hear from healthcare consumers when we're doing focus group work is the inability to take care of some of their basic needs. And some of those are illustrated here in the examples on the screen. 8 to 8, 2 people for 10 minutes on the hour. Visiting hours still exist in many facilities, and we haven't necessarily taken that down to the degree that the consumers have changed their expectations of having to be progressively in a position to protect their loved ones and participate in a meaningful way in their care. And that's a simple thing for us to get our hands around, and there's lots of evidence out there of the benefits, but it's still amazing that we haven't been able to get our hands around that completely as an industry. Hospital gowns, if you ask people what you're going to wear when you're in a hospital or when you go into your doctor's office, many people still have that perception of being exposed and not treated necessarily as a human being, but they can measure that. In some organizations we work with, patients actually have the ability to choose the color of their gown, and it covers them in a respectful and dignified way, which prepares them for a conversation about their health care and the opportunities before them to participate in a meaningful way in a completely different way. It says to the individual that the organization truly does respect them in a different way. Building beautiful hospitals is one thing, but driving loneliness and the opportunity to create better experiences within the physical environment that support greater engagement, people can recognize that, understand that, and measure that. And certainly hospital food is another one of the things that we still hear about. I had somebody in a recent focus group ask me a question that if I was walking into a local restaurant that evening and I ran into them and I asked them, how was the food? And they said it was just like hospital food. Would I continue on, or would I turn around? So those are all things that, again, are within the consumer's perspective, that are opportunities that are more easily taken care of if we're paying attention to. And if we do those well, they do differentiate our services from our nearest competitor. Other ways for differentiation to occur and to be measurable and understandable is how people are treated personally. And one of the systems that we work on consistently with organizations is really taking a look at how do you personalize the experience for the consumer, the patient, the individuals that you care for. What do we do to not only know who they are on a personal level, what their hopes, their aspirations are for their care experience, and what their hope is for their health? How do we actually do that in a personalized way that makes and provides meaning for them? How do we capture things like preferences in terms of what their hopes and aspirations are? And I think more importantly, in going forward in healthcare, is how do we remember those preferences and share those across various points of contact in the healthcare system. When we do that well, it changes the equation pretty significantly. And one of the other ways that I think consumers are starting to see differentiation in the marketplace, and it's very easily identified, is the ability to participate in a meaningful way in their information and access to information. Whether we're talking about the Open Notes program that is taking shape across the country, or if we're looking at the work that we've been doing as an organization since 1978, where organizations have consistently asked patients and presented to them, you have the opportunity to read your medical record, you have the right to read it, you have the right to understand it, and we will make sure both of those things happen for you should you choose to participate in that way. That is a clear differentiation strategy from most of the healthcare experience that people have either had previously or that is even available today. So it's not just a portal activity, it's how do we provide patients the opportunity to participate in a meaningful way. And what we found over the years is not only is it advantageous for the patient, it's advantageous for the organization, the caregivers as well, and puts people on a path to be able to participate in their care in a more meaningful way. Again, differentiation strategy, absolutely. And then a recent conversation I had in state here in the West, a group of active patients actually put forward the idea of the Open Notes program to a number of local significant providers in the local area, and basically presented it in this way. We're going to put this forward to each one of the major providers in the area. We'd like you to say yes to this, but if you don't, let us be clear, we're going to present it to the other 6 providers in the area as well, and do you want to be on the outside of that? It's really a change of consumers bringing solutions that differentiate the service experience. Another way of differentiating the customer experience within healthcare from your nearest competitors is, do we actually engage the patients and their families in an active way in their care, in their health, their wellness? And if so, how is that demonstrated? I'm just sharing one example here where organizations mindfully create partners in care as people come into the healthcare environment, and they talk with the patient, who would you like to partner in your care? There's a plan that's developed, and that care process and partnering happens from the very beginning of the care process and across the continual contact in a very meaningful way. So it's moving from doing 2, from doing 4 to doing with, and co-designing the healthcare experience for patients. And what we've seen in organizations that do things like a care partner program is improvement in readmissions because of failed attempts at home care, the ability to manage your medications in a much better way, and overall satisfaction going up, while many times acuity has gone up at the same time. So when we talk about who is involved in determining what the needs are for customers and potential, probably no surprise that a primary focus of all 3 presenters today has really been an intimacy level with customers that maybe we haven't seen before. This is one of my favorite stories in this discussion about who's involved. This is actually a quote from a nurse that I used to work with, who said, patients really, what patients want is not rocket science, which is unfortunate because we're really great at rocket science. We love rocket science. We're not that good at some of the basic things. In a more recent experience, I was actually talking to a friend of mine from IHI who provided me this text that actually came from a rocket science in communication with her rocket scientist, who came from a conversation with her physician and said, he's out, he's taking post anesthesia. Doctor said it went really well and said a bunch of stuff I didn't understand, but he was very pleased. That's actually coming from a trained rocket scientist. So one of the things that when we think about determining what needs are, it's really a level of intimacy and conversation before programs are really developed, not at the end, which tends to be the case. And I think this slide presents some of those opportunities. Many times we create solutions, present those to the marketplace, ask consumers after they're 90% built, and enhance them ever so slightly. So what we've found over the years, and I think it holds clearly across a variety of different cultures that we've worked in, is that by talking to patients, really understanding and presenting to the patients that they are the experts about themselves, that we really are listening authentically, and we want to co-partner and co-design with them a healthcare system of the future that specifically takes their individual needs and provides for those needs in a flexible but consistent manner, is really the stage of healthcare in terms of where we're going now at that co-design level. And it's more than just seeking opinions, it's really involving them from the ground level in the design of programs and systems. When we think about what are the ways to effectively respond within the local market, I think both Romero and had spoken to this certainly in his conversations as well. We want to have patients involved at a very significant level, and that is across the entire continuum. It's bringing multiple stakeholders into the conversation and consistently keeping them in the conversation over time. So it's not a one-time and out, or eventually we'll get to the consumers, actually bringing them in early, keeping them there often, and integrating them fully within and across our system. The other way to demonstrate or to meet these local demands and markets opportunities is to fully integrate and involve the the staff and providers that we work with on a daily basis, making them, I think, as was just mentioned, part of the team that is the marketing department for the organization, and really connecting that with why they went into healthcare in the first place. Not just that we're trying to create a difference in the numbers, but this is how this connects with your personal philosophy and what gives you value in delivering care on a daily basis. Finally, really preparing organizations and staff and various partners to be your partner in that process. We have one organization that actually spends time both orienting its providers, its staff, but also its payers and its community in terms of what their value equation is, what they're aiming for, what their hopes and aspirations are going forward. And at the end of the day, it really is an expression of what the story is told from person to person, not necessarily what we put on our website or what we put in our marketing message. Those things are all important. They demonstrate what we stand for. But what we find at the end of the day many times is you can tell the success of an organization in this particular space by the stories that are told by patients, families, and providers. And so I'm going to go ahead and pause there, and thank you, Greg.
Thank you, Randall. You did a great job of explaining things through the patient's lens and patient experience. And today's rapidly changing healthcare environment, is patient experience a sustainable differentiation strategy? And if so, what are some of the essential components to create and maintain gains in the marketplace?
That's a great question. I think one of the key concepts in terms of differentiation is that you get into the co-design space early and potentially before your competitors. Most folks are doing market research and talking to folks about, what they'd like to have in their healthcare experience. But I think if you go deeper and actually pull your community together with the idea that you're co-developing and co-designing the healthcare experience and system of the future, once you're in that space, it's difficult for other folks to be able to come into that space effectively. It really becomes, we're trying to be like those folks who led. And I think the organizations that are having authentic conversations consistently across their consumer base with key stakeholders hold an advantage. It's going to be difficult to catch up with.
And then can you tell us what are some of the ways that healthcare organizations can move beyond patient and customers as advisors to more engaged partners in the healthcare in the future?
That's actually another great question. I think many times we have patient advisory panels. We've seen organizations turn those into patient partnership councils or stakeholder partners councils we see those individuals informing and participating in deep ways in the organization, everything from hiring to quality and safety committee activity, really developing both the wellness strategies locally. We've seen organizations take a very unique step where they have all of the key stakeholders within their community, county government, city government, education, and so on, sitting around the table, and all of them have defined and integrated health into the mission statements of each of the organizations, so they've been able to create common ground and a place for continued conversation over time.
Thank you for sharing that. Before I pass the floor over to my colleague, Keith, I just would like to ask a couple quick questions to the panel. The first question is what roadblocks have you encountered in implementing your strategic plan, and how have you addressed these challenges?
Yeah, this is Romero. Maybe I'll kick us off. I think there's always obviously barriers to executing a strategic plan. First and foremost, I'd say from a corporate perspective, it's always our ability or desire to grow. And when we don't hit the targets we're looking for, we're always looking to re-energize our efforts and perhaps, and I mentioned it earlier, and we got to be clear about what we should do and we should not do. Some of our barriers are created just by the market conditions and how we address those or shift around those. So most of those are obviously market-driven, but the strategist in all of us, especially our marketing strategy, should look through those barriers and see where really we want to take the organization to serve our patients and consumers.
This is Don. I would agree 100% with that, and I would just add that I think another challenge that you encounter, I think, in planning and sticking to your strategy is something that was teed up at the very beginning of this session. Was the risk of losing focus, and I think the discipline that it requires to keep on strategy when so many things are coming at you that may be very tempting. You could make a case, but it's not on the roadmap, and you have to really ask the critical question: does it fit? And I think having to just take a step back every time a new opportunity comes in, and that doesn't mean you don't say yes to new opportunities, but you've got to run them through that filter of your strategic plan and making sure that anything new that's coming in the door aligns well with the goals that you've set for the organization. I think the biggest risk is taking a detour off your strategy.
Yeah, and just to build on that, I think that's absolutely, both comments are right on target. That ability to focus is absolutely critical, and I think if you're able to design into your system the integration of the patient's voice, the patient's perspective into everything that you do, you provide yourself the opportunity to maintain that focus and consistently ask the question, yes, but from the patient's perspective, how does this add value? How does it create an opportunity that is desirable?
Thanks for sharing that. I'm going to propose one more question before we turn the floor over to Keith to take questions from the attendees. In an ever-changing healthcare environment, does it make sense to have a long-term vision and strategy?
This is Don. I'll jump in on that. I get us started. I think the answer is yes. You have to decide how you define long-term, and if you know who you are as an organization, I'm speaking as a marketer, understanding your brand and your place in the market, at least long-term, it'd be 3 to 5 years out, knowing that you can't predict much beyond that, and our CEO sort of communicates that to us, that in the dynamics of healthcare today, it's hard to look past 3 to 5 years. At the same time, we do have to make decisions when we're looking at, say, building facilities. Decisions that are made today won't be realized for well past that 3 to 5 year timeline. It takes a long time to build a new hospital, for example. So a long-term strategy absolutely is needed, but it has to be nimble enough to pivot when market conditions shift or when new competitors enter the landscape. I don't think you can have a rigid strategy. You need to have a strategy that is directional and nimble.
Very well said.
Just to build off of that, I think the level of information going into that that comment about long term is accurate. I think what does make sense, in addition to what Don just shared, is there needs to be an opportunity or somebody within the system that really helps to illuminate and create a desired destination and point to rally around and assemble the thinking of a diverse set of partners on a regular basis, and something that differentiates you from the competition. And so I do think that 3 to 5 years is still important, but the nimbleness and flexibility is critical.
Now I'd like to take the opportunity to pass the floor over to my colleague, Keith. Good afternoon, Keith.
Thank you, Greg. Now we would like to open up the floor for questions and answers from the attendees. On the left-hand side of the webinar platform screen is a text box to write a question to the presenters. If you have a general question, please insert your question into the text box. If it's a specific question for one of the presenters that you would like to ask, please insert his or her name next to your question. At the end of today's webinar, you will be directed to a short survey which the Central Illinois Chapter of the American College of Healthcare Executives and Idaho Healthcare Executive Forum hopes you will take time to fill out to help in planning future events. The first question that I have on here is one for Ramiro. You need to have a strategic communication plan so that the entire staff and their customers stay informed and stay engaged. What is your idea of a communication plan to accomplish this goal?
Yeah, thank you for the question. It's a great question, and I agree with my colleagues who are telling us all that really the brand, the messaging, the influence comes from every single staff member that works in our institutions. The way we develop our communication plans is we develop communication pillars that support our value proposition. And again, you do this with relative importance to the customer's perception. Those communication points are then translated to the individual departments or roles and communicated and put, honestly, the talking points in scripts where appropriate, where we want to make sure, for example, when you call us on the phone and somebody answers and picks up for the appointment, it's exactly the same positioning that we want to drive as when you come in through the doors into the ER or for us, into one of our facilities. You really need to be that detailed where your broader communication plan, you have communication pillars, but then take that down to the lowest common denominator in the organization, who really is the one that touches the customer. So it's a combination of the strategy on top and then the detailed execution to the individual.
Thank you very much. The next question I have here is for Don. How are brand surveys conducted, or better yet, how do you identify the individuals or the customers and get surveys to them? And how long does that process usually take?
We work with a third-party vendor who provides the digital platform and helps us with the recruitment of those online patient panels. And we can put out a survey relatively quickly through the platform, and patients sort of self-select to come in based on whether or not they were sent the request, and we do stagger those requests so that no one patient is being surveyed too frequently. The panel population of potential panelists is large enough that we can do that.
About how long does that process take?
We can usually turn a survey around in 2 weeks.
Thank you very much. This one's for Randall. Much of the direction is from volume to value. What is your method to move from a fee-for-service environment to more bundled payments and looking for better ways to define quality and value?
I think that's a great question. Again, I think trying to define that from and through the eyes of the patients and families that we serve, and certainly the payers and communities that we're in as well. I think what we're seeing more often than not is more of a tendency to focus on population health and the opportunities to create both health and wellness, and also personalized health coaching is one of those elements as well. We're seeing greater growth in the areas of what we would normally call complementary and in addition to the traditional medicine that we've provided access to, and it's really trying to find the right venue to deliver the right care at the right time that allows people to feel like they're making the right choice to navigate and direct their own health.
Thank you very much. As we're already getting a little over time here, I'm going to close the question and answer session. At this time, we would like to especially thank today's moderator, Greg Wallstrom, our presenters, Ramiro Roman, Don Stanziano, and Randall Carter, and the support from Angela Jago and myself, Keith Hirth, for taking the time to share pertinent information about strategic marketing, winning the battle for market and shares, and the impact it has on each of our healthcare organizations. The Central Illinois chapter of ACHE will be holding an all-day face-to-face event on Monday, May 20th, 2016 on career positioning, proactively managing your professional, the impact of the ICD-10, how implementation will affect the healthcare executive's mission, and employing social media to build customer satisfaction and community outreach. This event is worth 4.5 hours of face-to-face education credit through the American College of Healthcare Executives towards your board certification or recertification. We would like to thank each of you and every one of you for taking the time out of your busy day to attend this webinar. There will be follow-up in approximately a week with instructions for recording your time and for this recording for this event. Make sure to log into your ACHE account to record your 1.5 hours of qualified education credit for today's webinar. This will conclude today's webinar. Thank you for joining us.